Dr. Shra, can you start?
Yes, indeed. Good morning. Thank you very much. Good morning to you all. My name is Dr. Amit Shra. I am currently based in London, UK. Thank you very much for making time to attend this webinar. Thank you to Candela for bringing us all together as colleagues and friends to have a look at long pulse radio frequency microneedling. May I also say from the outset that I will be taking, I'm quite happy to take any questions post the actual webinar. If you can kindly post them in the Q&A box, I will do my best to answer as many, if not all of them, at the end of this actual webinar. I must also say to everybody, I hope everyone is well and their families are safe amongst our difficult times. Here in the UK, we are still on lockdown, so I am speaking to you today from home, but I must give you a small background. My primary profession within the actual medical sector is as an emergency consultant, and I am currently helping out amongst the other physicians in the UK on the front line. And today is my day on doing what I normally do, which is an aesthetic practice, which we have in London's Harley Street. I'll lead into our long pulse radiofrequency microneedling talk, but please do feel free to write any questions and answers, and I will answer those towards the end. Okay, so if everybody can sort of concentrate on the actual picture that is being displayed here for the moment, what I'd like to point out is we have a variation of 3 pictures displaying the process of younger skin leading into older skin. Now, it's a very simple process of knowing that every single day we age. And as we start to age, we start to lose one of the most important building blocks. Now, often within the clinic, we find people are always coming in saying, I need to get some more hyaluronic acid. I need to build some more hyaluronic acid. And whilst that is actually correct, what are the actual attributing factors that will help the hyaluronic acid to do what it needs to do? Well, it needs to be supported by 2 very important structures within the skin surface. As we can see, our bodies do stop producing a very important structure called elastin, and this starts to decrease at about sort of, a rate of 1 or 2% once we start to get into our 20s, obviously increasing with age and also further with any trauma to the actual skin surfaces or the actual body. But elastin is also supported by collagen, and collagen subsequently also helps to increase the amount of skin volume and elasticity that we actually have. So in short, in summary, the 3 contributing factors to support a stronger, more youthful appearance of the skin, and I'm namely sort of pertaining to the face at the moment, whereas we will sort of delve into other body parts. Elastin, collagen, and hyaluronic acid collectively form the synergistic triad that will help to support the skin surface. Now, if you were to actually look at histologically, the loss of all 3 is what will cause the skin to lose its supporting structure, its cement, the actual building blocks that hold the skin together. And the loss of all of these 3 collectively will cause what we classically sort of cause wrinkles or deficits in the skin. Now, either which way, patients or clients, whether they're young or old, and I mean old in a very gentle sense, will always look to seek ways to prevent the actual loss of skin volume and elasticity. So it's important to recognize the entire basis of what we're about to delve into from the microneedling aspect is to ensure that the 3 things, elastin, collagen, and hyaluronic acid, are collectively built to produce the result that we want for our patients. Now, coming on to our next slide, it's very clear. I mean, anatomically, as physicians, we all know what the sort of structures are within the skin and the deeper layers. But what we have to look and see is how can we help and support the aging face? I mean, skin elastosis in the aging face is a complete result of the lack or the decrease of weakened collagen in the deeper supporting structures. And from the previous slide, what we know is collagen, elastin, and hyaluronic acid are the three things that we want together. But if you can pertain to look at the right-hand side here, collagen, as you can sort of recall, is the actual protein, one of the most abundant proteins that we require within the actual skin surfaces, but it's the actual cement or the lattice work that supports the deeper structures. So if you were to imagine layers going across horizontally, the collagen would be the supporting structure between these layers, holding them all together. And if this support wasn't there, the layers would start to drop and sag. Ultimately, under gravity, and looking at the face on this aspect here on the left-hand side, you would start to have a skin elastosis, or a drop or a drooping of the actual skin. Now, the two areas that I would like to really concentrate and keep in your minds are the submalar hollow is something that starts to become very prevalent as we all start to age, and the actual anterior cheek bunching also occurs quite quickly. So we must keep this in mind when assessing the actual patient to see what we can do to help them. But again, please do remember, collagen, elastin, and hyaluronic acid collectively are what our attempt is here to increase the amount of. Now, what I'd like to look at is the actual product overview itself. What is the actual system that we can utilize? Whilst we're all familiar with very many sort of products within the market that can help to support the skin in the short term, whether they be from an injectable perspective or a topical perspective, what I'd like to look at is something that allows us and has allowed us within our clinic in London to look at supporting the actual skin from the deeper structure perspective, whilst also maintaining that it is a proven technology. Obviously, the product we're going to talk about here is the Profound by Candela, and I'll delve into explaining this. This is the system, if you can see on the right-hand side, and what I'd like you to concentrate on, just for the moment before we go into reading the actual slides, are the ease and the look of the system. One of the most important factors that we have whenever considering acquiring a system to help our clients and patients within the clinic is how easy is it, one, for the physician. And I must stress, it's very important that this is a physician-led instrument, which can be supplemented and helped with the help of nursing staff and estheticians. But a physician-led device must be something that is easy for the physician to use, must be user-friendly, must be easily accessible and mobile to move around a patient. Essentially, we are never treating the patient head-on. We will always treat from left to right or right to left. So we want ease of movement. And the device, I must say, is very easily movable. It's quite a light device, yet packs a very powerful punch. I'd also like you to sort of take a look on the right-hand side and see there are two cartridges which both have this red bit in between. Now, the two cartridges will signify, and I'll explain further, are to have a superficial, more sort of shallower treatment for the actual sort of loosening of skin, and a deeper treatment, which can be looking at the actual fatty layers on the face and also deeper cellulitic pockets within the actual sort of body surfaces itself. But what is the most important thing for us within the clinic, or physicians, I always think, is most certainly ensuring that studies have been performed, devices have been accredited, the devices have been tested and certified by an organization, so that you are reassured that the product you are utilizing is a succinct, robust product, and also your clients can be reassured that this is not just something that has come to market without any authority looking and assessing the device. So what I will say is the Profound, whilst it provides a comprehensive single treatment both for the actual dermal, which is more shallower, and subQ, deeper layers of the skin, the greatest thing that we found was this is actually the only FDA, and FDA is very important for us, I think globally, but in the UK, more so than the MHRA, our patients actually often come and ask, is your device FDA cleared? So it's a very clear-cut distinction in a patient's mind what they think an authoritative organization should be when it comes to an individual device. This is the only FDA cleared device that delivers long pulses of bipolar radiofrequency to improve, again, the three structures that I always come back to, the elastin, the collagen, and the hyaluronic acid. It has a study that shows there is a 100% response rate. Now, everybody will have a different feeling or an element of how much response that they have had. The study here shows there was nothing or there was nobody that did not respond. So every individual person, and I can verify this from all the clients that we have utilized the system on, everybody does get a response. This is also further backed up, and I think it's actually more than 8 peer-reviewed clinical publications at present, but at the time when we procured the device, there was 8 peer-reviewed publications, which allowed us to understand what our colleagues from a scientific field and medical fields had looked at and assessed the device to be. Again, it is the only FDA-cleared, real-time, and most importantly, temperature-controlled. A lot of devices will allow people or physicians, and some devices will allow non-physicians to utilize an instrument but not control the actual temperature. They will allow you to go to a certain depth at a fixed temperature and perform a treatment. The Profound allows you to vary the temperatures. We'll go into the specifics of them, but I can tell you we've treated patients which have gone from 67 degrees Celsius all the way up to 71, 72 degrees Celsius. So the variation in temperature with the impedance feedback from the tissue is very, very important. And this is subsequently something that is measured 10 times per second. Now, why is that important? Well, when we as physicians are varying temperatures, what is the one thing that we all start to think and worry about? It is really, could we potentially harm the actual largest organ there is for the patient, the skin, and cause a burn? It's not what we want to do, and it's not our objective at all with the patient. So the ability to fully customize the treatment and vary the temperature gives you a greater degree of control and allows you to set what your targets are and vary the duration of the treatment. Think of it as a very simple handpiece which you can vary the temperature upon and additionally vary the duration that you want that temperature at. And I'll further explain what parameters can be utilized to help someone from loose structures on the actual face versus the other body parts. What's also more important is each patient has a single cartridge. Now, some people may worry that actually these are consumable elements. What I like to understand by this is very simple. There is a decreased, if not zero, risk of infection from a cartridge perspective. Thus, one patient, one cartridge, dispose of the cartridge safely, decreases the risk of infection. And that's always important. The Profound itself sits in a slightly astute element purely for the fact it's in a class of its own due to the fact the actual needling. Now, when we think of the needling going through the actual skin, the gauge of needle used will be the issue of how much trauma is caused. These are 32 gauge micro needles, so they're very thin, very, very easy to penetrate the actual skin surface and essentially cause the actual effect that we want. Each of these needles is electrically isolated, and the actual isolation allows us to ensure that there is a decreased amount of risk of burning the actual skin itself. Now, looking at the actual sort of slide here on the right, what you can see is the actual needle length, which is the green element plus the gray element, which is surrounded by an area of red and yellow. Essentially, the total length there is 6 millimeters. Now, you've got 3 millimeters of that, which is Teflon insulated proximally. Therefore, you've got a thermocoupled effect at the remaining 3 millimeters. So, what you do not have is an entire burning episode through the length of the needle itself. The needle also shot out at the same angle, subject to you placing the device correctly on the skin. So, you've got a 6 millimeter needle that has penetrated the skin, and you've got the primary 3 millimeters, which is going to provide the heat at the temperature that you have selected for the duration that you have selected to the actual structure itself. And again, what we are doing is aiming to ensure that we're within the actual dermal layer. Thus, if we can cause the trauma to the area within the dermis that we want, you will go from the left slide to the right slide and see the increased amount of structure that you require. Now, the fractionated zones of thermal injury created are distal. So essentially what we're not having is a proximal injury to any of the tissues. Again, if I was to just refer back to the 2 cartridges I mentioned 2 slides ago, there is a dermal and a SubQ. Now, the dermal has 10 microneedles, i.e. at 5 pairs. So you've got 5 pairs that will penetrate to a more superficial depth versus the SubQ, which can be used for body parts in our clinic, that has 7 pairs, thus has 14 microneedles, which can go to the depth of up to 5.8, so almost 6 millimeters. The actual dermal pairs of microneedles will go more at a sort of straight down angle into the skin, whereas the SubQ will go at an almost 135-degree angle. I will get to what is used from a sort of cartridge perspective on different various face types and show you imagery of the results post the treatment as well. But it's important to remember, your dermal is superficial, 5 pairs of needles, whereas your SubQ is deeper and has 7 pairs, and it goes to the depth of 6 millimeters. What is the science and the actual mechanism or mode of action behind the actual system? Well, let's get into that. Again, any questions are more than welcome, and thank you for those of you that are writing them. I will answer them for you post the actual webinar. So, if I can always encourage everyone to remember, what we do need to ensure is what are our optimal parameters for treatment should we not want to vary the temperature setting or the duration that we're going to apply the actual energy for. Well, the thing to recall and the thing to remember is, what is our zone of partially denatured collagen? Because this is the actual zone which we find helps to ensure the skin achieves the best or the optimal result. Now, the profound is minimally invasive. There is no incisions that are going to be made. There is no actual sort of, surgical face lifting elements to this. It's a very easy, minimally invasive bipolar device to use that allows you to select the energy and the duration. Now, this is coupled up and proven with the research that's done that the optimized thermal dose of treating somebody is around 67 degrees Celsius at somewhere between 3 to 4 second triggers. Now, why have we written 3 to 4 seconds? Because the device allows you to have those parameters set. You could set the device to deliver energy for 3 seconds, 3.2 seconds, 3.4 seconds, 3.6, 3.8, or 4 seconds. And everybody's face and skin is different. Therefore, you may have to vary what you're doing on a female patient versus a male patient. So you could have 2 patients at 67 degrees Celsius, one being treated at 3 seconds and one being treated at 4 seconds. The duration triggers a strong wound healing response, which is what results in the partially denatured collagen. Again, the device itself is helping you by ensuring that it is measuring the amount of energy 10 times per second. And the importance with that is it allows you to maintain that are you getting the correct target temperature regardless of the condition of the skin. Because what you do not want to do is treat one side of the face and you've got part of that side treated at 67 degrees and 3 seconds and part you didn't achieve the same at. So the device will tell you, actually, problem, you haven't gone the correct angle or not achieving the zone that you should be achieving of partially denaturing that collagen. Now, importantly, when we are talking about heating, and we say very easily that we're going to sort of cause trauma and heat certain elements of the actual skin aperture, what we want to ensure is that, again, no burns occur. And the device itself has a surface cooling plate that is actually applied. And it'll be very interesting for those of you that actually ever do get the hands to look at a cartridge. The cartridge has this cooling plate, which is a small metallic plate, which allows the treatment area to be cooled. And this is integrated into the dermal applicator to decrease the thermal damage to the epidermis. Why to the dermal applicator? Well, the risk of burn is always there more superficially. If you recall, the depth of the needle going in is about 2 millimeters. Therefore, it's an easier target to burn, but with the addition of the surface cooling plate, this is decreased massively. Nobody wants to achieve any burn on any patient's face. Again, the graph here will show us that an ideal zone of partially denatured collagen is reached at 67 degrees with a mean time of 3 seconds. Therefore, the skew is allowed between 2 and 4, but I will tell you, we often find that the ideal elements to treat are between 3 and 4 seconds at the 67 degrees Celsius mark. For those of you that have an affinity for histology or histopathology, the actual slides here are very simply going to show us. If you look at the difference between the actual slide on the left here, which is A, and the slide on the right, which is B, we can see the actual dermal sparing between the lesions. And this is what promotes that anabolic response, that growth response. If I was to ask you to please maintain a look at slide A, the actual terminology that we've utilized here is that focal lesions of thermal coagulation are surrounded by uninjured tissue. Okay. So what we're looking at is there is tissue that has been heated, but the tissue around that area that has been heated has not been damaged. Therefore, we are ensuring that the area that the needle goes and sits within and delivers energy, that specific area is the only one that is treated. Thus, we ensure that we have adequate spacing along the actual cheek or the chin, or the neck surface to ensure we are covering the entire area. If you take your attention to slide B, it's written here that the lesions of thermal coagulation become more contiguous when time at temperature was increased. Essentially, due to the fact that we can vary the actual temperature between 67 and again going all the way up to 74 for those of us that have become quite experienced on it, and varying the time duration, you can go as low as 3 seconds, as high as 4. There are parameters outside that for the more experienced physicians utilizing this device. But again, what we're noticing here is that this sparing between the lesions is the thing that is ensuring that we have an anabolic response, i.e. we have a targeted cell structure that has received energy, thus has become more contiguous when you have operated it at a time increased temperature. If anybody has any specific questions on these, I would be more than happy to sort of take them afterwards. I can see a few of you asking the questions in regards to this, but I will sort of answer as best I can later. Now, again, we're going to go back to one of the most important factors, and we look at 2 slides here to clearly display 2 of the 3 parameters that we're trying to achieve. Again, an increase in collagen an increase in elastin, and an increase in hyaluronic acid. Looking at both of these slides, if I ask us to look at the actual slide on the left, the bottom here on the left shows old collagen versus more towards the top left, which is new collagen. Those, again, who are very much sort of interested in the histopathology, what you're looking at is the increased density of thickness that we can see in the new collagen structure versus the old collagen structure. So the lack of white areas in between the pink is what we want to achieve. And that is what can be seen at 10 weeks post somebody being treated. If we go to the slide on the right, although a little bit difficult to assess and see, but you can see these darkened worm-like structures are the elastin deposition that has occurred versus the slide here on the right. If you look at the bottom left of it, has not many darkened little sort of lines or worm-like structures versus the slide on the right at the top, it has lots of darkened worm-like structures. And what that essentially is your deposition occurring and filling an area. Again, the actual collective effort of the collagen and elastin will also help the collective effort of the collagen, elastin, and hyaluronic acid in supporting the actual skin. Now, what's important, and I think often physicians will look to ensure that they know everything when it comes to the actual medical terminology of a patient's treatment. But what we often forget is recognizing what is this actual device that we're using. And for those of us that want to know, the Profound system is a Class 2 device according to the US FDA, the Code of Federal Regulation. You as a physician are responsible for ensuring that you check with your respective regulatory bodies that what you are doing is also correct, but it is supported with the fact that the company has taken the time and effort to gain the accreditation. And so many times we are presented with devices that we actually don't know what class they are, how well the system works. So for those of us wanting a little bit of knowledge, it's a Class 2 device and it does have the FDA approvals. Now, if we can concentrate on the left-hand side of this slide, please, guys. When we're assessing an aging face, while it's very much important to conduct a succinct consultation, have a difficult discussion prior to doing any treatment, so you've covered all the questions that the patient has, you try to address them as best as you can, and you've ensured that you've explained what you can do, and you've explained all the limitations of what you can do within your setting. It's very much important to obtain history and photography of the face, to record all of the assessments, but the degree that you must assess, if possible, amongst others, and I'll go through this systematically, the quality of tissue that you're going to be treating, what is the degree of sagginess or wrinkles or deficits or defects within the skin, how much elastosis is currently present, and what volume you think you may be able to add. Now, some of these are guesstimates, and you become very much more better at giving these answers to the patient the more treatments that are done. However, these are parameters that are hugely important to assess with the patient and be clear with your response to the patient prior to treating anybody. Now, the Profound system here on the right does have a treatment record, which very helpfully you can utilize and put your own clinic logos on there or adjust it. And myself in the clinic that we run at Cosmobute in London, we have taken elements of the treatment record to show to the patient what we're going to do. Now, the pictures at the bottom here on the right-hand side give you an idea of what direction you're going to be treating within and give you an idea as to the parameters and the limitation that you have. One of the aspects that I find is always very, very, very important to discuss. You are going to be microneedling someone's skin. There is a depth possibility from 2 millimeters up to 6 millimeters. You are going to be using local anesthetic prior to the treatment. In the right-hand side part of the picture, it says here in the treatment areas, local anesthesia, the medication, the dose, the total volume infiltrated. It's important for everybody to ensure that they are very well aware of what the rate limitations are in applying anesthetic according to someone's body weight, size, and any allergy status that they may have. It's important that you are clear with the patient that prior to the microneedling element, you will be applying local anesthesia with the use of some needles as well. And I'll go into the type of anesthesia that is used. But important that the patient knows they will have a small element of discomfort when the anesthetic is applied. I must say it is a small element, and often when I ask patients, could you grade this on a scale of 1 to 10? I often find they say, Amit, it is somewhere between a 2 and a 3 at the most, and only for a second or so whilst you are injecting. Now, performing the treatment. Whilst this content is not really intended to be a substitute for your professional medical opinion, your own experience, this is a guide that can be utilized. But remember, guides are there to help you. Your experience is there to ensure that you do the best for your patient. We're going to consider the face, and that is the parameter, that is the actual area that is most often utilized for treatment with this particular system. Again, we've utilized this quite openly, I will tell you, on the abdomen. We've utilized this on the arms, the upper arms, in and around the actual elbow area. We've utilized this on the buttocks and the thighs. But for the purposes of the face, which is the easiest treatment parameters to get across, if we look at the actual left-hand side of this slide, and together we would, consider what is the treatment plan for the patient. But we want to look at the anatomical area that we're going to treat. Accordingly, once we've assessed our degree of treatment parameters, we're going to look at the cartridge selection. So if someone's got a little bit of skin sagging, we will probably look to have the actual dermal tip. So that is the cartridge we will select. We're going to have to look at the parameters to treat, i.e. the temperature and the duration. Let's look at the severity of the condition. I mean, there are some cases where the skin elastosis and number of defects or wrinkles are thus that we may not be able to achieve what the patient wants just in one setting. I often get asked by colleagues and physicians, Amit, how often can you do this treatment? And again, I will get to that one at the end. But it's not just a have it once and walk away. The treatment itself has been designed to ensure with one session, you will get a response. But I do find that some patients, depending on the severity of what they're starting on, may need something further along their actual treatment journey. So therefore, it's important for you to get to the next part of it, which is ensure that you've assessed the tissue and the quality, because what you are treating today, you are hoping you have better quality tissue should you have to treat again in the future. Maintaining the actual orientation of the applicators is very important. You're essentially driving needles, and you want to ensure that you drive them at the same angle every single application. Therefore, there is a skill involved in you ensuring that you are holding the actual probe correctly, and that you try and maintain a equal or equidistant area between the number of insertions. So, looking at the right-hand side where we've got basic treatment parameters, if I was to ask us, please concentrate on the line which says dermal. The indication for this would be facial wrinkles. The temperature we would set, and going in Celsius here, would be 67 degrees Celsius. The duration, let us assume we are going to start with 3 seconds. We would quite happily ensure that we tell the patient, look, you're going to be receiving the depth of 2 millimeters of the microneedle with the last 1 millimeter of it heated. The spacing is every 3 to 4 millimeters. Again, assess the baseline condition. If you were to now utilize the larger tip, which is the SubQ, or if you look here at the right-hand side, there's a picture of the actual lateral part of the left and then the right thigh. If a cellular deposition was noted, you may utilize the SubQ tip. Again, your baseline temperature of 67 degrees Celsius is what you know you have the best fractionated zone of denatured collagen forming at. Due to the depth that you're going at, which is up to 5.8 millimeters, you may want to increase the duration of energy you deliver. So instead of going at 3 seconds, we can go to 4. Again, for those of us that are new to the actual device, going beyond 4 seconds in the beginning is not something that is suggested. But again, if the area that you're treating has a greater degree of severity, you may want to. But again, consult your practice development team or ask one of your colleagues in the Candela world. More than happy to take all of those emails directly myself as well. Again, the spacing you would maintain is between 3 and 4 millimeters. What's greatly important and what's hugely important to stress is the patient should be, from the facial treatment aspect, assessed when sitting upright or standing. Whilst for cellulite, whilst we know the grades of cellulite, we want to see the degree of drop, so always assess cellulite with the patient standing. I'm sure you all do this, but as it's not easy to see everyone's face, it's just easier to say. And you can use suitable skin marking pens to give yourselves a template or a guide as to where you're going to be inserting the actual anesthetic, which is a tumescent solution, and take it from there. Now, getting onto the local anesthetic, and often physicians may feel, well, okay, the probe is something that I've got to hold with the correct cartridge, with the correct temperature, the correct duration, at a certain angle, and the needles will penetrate and heat, and that is it. But, Amit, my difficulty is injecting the anesthetic, or I'm not really sure how I feel about that. Well, I can tell you something. It's very simple. It's very easy. What I would like to just point out before we go into the actual provision of reading the slide is on the right-hand side, the upper slide has a blue plate with 3 needles. Now, this is a linear plate which has 30 gauge needles on the end of it, which have a depth of 4 millimeters, and they just allow you to inject equally over a larger area, thus decreasing the amount of time it takes to inject the anesthetic volume over an entire face. I will say there is a 3-plate linear model. At the bottom slide, there is a 5-plate linear model, and you also do get circular 5-plate and 7-plate ones. But for the purposes of the face, concentrate on the slide on the right-hand side at the top, and the linear plate with 3 is easily utilized. Now, you may elect to cool the actual skin surface whilst you're injecting via some chilled air mechanism, or you may elect to have prior applied some topical anesthetic, then ensure you have cleansed the skin appropriately, and then apply the actual anesthetic. Now, the anesthetic solution for the face here is a mixture of lidocaine with epinephrine. Most naturally, we want to sort of decrease the amount of bleeding that can occur. We will utilize some of the sodium bicarbonate solution in that to ensure we take out what the patient may feel as a sting. You can utilize what you are comfortable in drawing up the actual needles. Again, this is a guide. 5 cc and 10 cc syringes work quite easily. The reason I say don't go beyond 10 cc syringe, the blue plate itself, if you apply too much pressure, it is plastic end of the day, may stand the force of that to crack, but a 10 cc syringe will only allow you to depress the actual plunger a certain amount. What you do need to ensure, what is very important, the angle at which you deploy and implement the anesthetic solution is going to be the template for the angle that you are going to utilize your cartridge. So if you are utilizing a dermal cartridge, which is going to deploy the needle at a 25-degree angle, what you really want to do is get into the practice of ensuring that you deploy and implement the anesthetic at that angle as well. For those of the colleagues that have the skill set of providing renal nerve blocks, you may at your own discretion, and that may provide more comfort for the patient as well. Inhaled analgesia is an option as well, a tougher option when you're then going to be injecting and then providing probing via microneedling off the face. So I find that is a little bit more difficult, but is a possibility. For those of us that have patients that do have some anxiety issues or are worried, we can give oral sedatives or calming agents. Again, it's very, very important to remember what are our limitations to avoid administering any excessive doses. The excessive doses would be very difficult, I feel, from a personal aspect to deliver when treating someone's face, but when treating someone's larger body surface, such as the slide on the right-hand side at the bottom, when you're treating a large area such as the thigh for what may be cellulitic deposition, you're going to apply an increased volume of anesthetic. Therefore, you may find it a safer option to decrease from 1% lidocaine with epinephrine to 0.5%. Whilst that is 1 in 200,000 still, the dosage differences are not a huge amount. However, you will be able to apply a larger volume of anesthetic because the area being treated is thus larger. Please ensure that you are well catered for knowing how to deal with excessive doses should that be the case. I don't envisage any of you will actually ever have that issue, but you should be very well aware of what to do and how to actually safely calculate what is your upper dose. And we've put it here at the bottom left-hand side. The safe dosage is based on the total weight of the patient. Thus, the maximal doses are given as milligrams of the agent divided by the body weight itself. Again, for those that have got any worries, I'm happy to always send you what are the safe doses that you should be administering according to the weight. Now, looking at the general treatment guide parameters. Again, we'll start off with our dermal tip. Dermal tip, again, at our nice, recognizable 67 degrees Celsius, which is where our research has shown us you will find that that is the heat parameter that will cause the best zone of denatured collagen. If we were to start off with somebody that comes in and has a mild to moderate baseline condition of their skin, we would ensure our treatment duration, well, it's mild to moderate. We've got an option of going between 3 to 4 seconds, mild to moderate. Let's go at the lower end of the treatment duration. Again, ensuring that we space at about 4 millimeters or 3 to 4 millimeters. We would concentrate here and say, why is there one pass written here? Would I need to apply anything more than one pass? You can, however, when it comes to the face and it's a small area, you will find that should you maintain a nice equal distancing of 3 to 4 millimeters, you shouldn't have to pass over the same area anytime more than once. You may want to adjust the angle at which you are passing across the left-hand side face to the right-hand side face according to the skin elastosis and or the quality that you find, but one pass is often more than enough. And again, moving to the right, this is adequate to treat thin dermal tissue, i.e. the wrinkles that people do not want. If I move on gently to the actual dermal tip where there is more sort of significant skin issues, your treatment duration may increase from 3 to 4 seconds. And you may also find, due to the volume or the number or the depth of wrinkles, that you may want to decrease your density spacing from 4 millimeters So you're actually increasing the amount of energy putting in, but you're decreasing the distance from 4 millimeters, maybe to somewhere between 2 and 3. Going less than 2 millimeters is very, very difficult. We are talking millimeters here as opposed to centimeters. And this is better utilized for thicker or a thickened dermal tissue area that's being treated. Therefore, you have an increased volume of energy that you are utilizing in that area. Now, moving from the dermal, which is more the superficial facial wrinkles treatment that you would apply, to the SubQ, which may be utilized for classically the cellulite deposition that patients may have. I will also say, for somebody who is presented with a patient that has excess fatty tissue beneath to the sort of chin neck area, if you can pinch enough to find actually the SubQ is going to be better utilized than the dermal, because the dermal again will only go to the depth of 2 millimeters, you may find from a pinch test actually the amount of tissue that you can utilize or grab is more than 2, or is likely to be more than 2. You may find the SubQ element is going to help you in the fatty neck tissue area. But concentrating on the cellulitic aspects, again, a mild to moderate patient, you've got a fair amount of cellulite that you're going to deal with. So I would stick to the upper limit of your duration, which is 4 seconds. You will have a mild element of skin problem, therefore you can deal with spacing of 4 millimeters. Now, it's a larger area, so you may have an easier time to crosshatch, which essentially means you go north to south, and then you'd follow it up by going east to west or west to east, which is your preference. So top to bottom and then side to side. Additional treatment passes can also be considered beneficial and more beneficial for a severe baseline condition. I will say when it comes to treating cellulitic deposition, we do find that we always do crosshatch. Again, everybody can assess the grade of cellulite and assess it with the patient standing up, not laying down. And this is a very simple explanation of your grade 1 to 2 cellulitic aspect, how to assess. Now, if you were to go to the bottom part of the slide, where you have somebody who has a significant baseline condition to start with, again, maintain your 67 degrees Celsius, maintain your duration of 4 seconds, just decrease the distance between the spacing. So go from 4 millimeters to maybe 2 or 3. And again, crosshatch. It's very simple and it doesn't need any sort of worry. What some people will be thinking and asking as the questions are coming in, I can see, is when would I vary the temperature from 67 to more? Again, if you wanted to deliver more energy and you had a patient, for example, that was a female who was 80 kilos with significant skin issue versus a male who was the same weight with a significant skin issue, depending on the depth of the skin or the actual density of the skin, you may find that an increase in temperature may help your treatment process. But for those who are getting used to the treatment, a safe zone is 67 degrees Celsius at the duration listed. Now, what are the key considerations that we look at? Well, the goal here, as we've been saying, is to have partially denatured collagen. The literature has shown partially denatured collagen is far more efficacious at triggering a stronger wound healing response. The graph here on the right is essentially here to ensure and enforce 67 degrees at that zone of circa 3 to 4 seconds is where you're going to achieve this zone of partially denatured collagen. And that is secondarily backed up by the thermodynamic research that has been performed. Now, the density of lesions deposited in the skin, we saw about 8 slides ago when we were looking at the histology slides, the increase of volume, the thickness that was ascertained. And the corresponding percentage of skin treated is always controlled by adjusting the spacing. So you can decrease the space between your insertions or increase the space. But decreasing the space would mean you're going to go every 2 millimeters versus every 4 millimeters. It's under your direct control. You control the duration in terms of times of seconds to apply the heating. You control the temperature and you control the spacing. So this is a device that is completely customizable to what you feel comfortable and what is correct in your mind to do with the patient. And it allows you to change your parameters patient to patient. Now, performing the treatment, which is the most important part of this entire element. If I was to just ask you to concentrate on the pictures on the right for the moment and recognize the two words, pillowing and skin tension. Now, if we come back to ensuring and seeing how are we going to manipulate the tissue to ensure that we've got a proper or adequate, suitable insertion at every single point we deploy the needles? Well, it's very simple. The back of the actual cartridge, which is towards the larger part or the right-hand side of the picture, you would place that flat on the skin, then push in a sort of forward rolling mechanism towards the left-hand side of the cartridge, which is the cooling plate. So where you will find the thumb and the index finger are almost pinching the cartridge, the most left-hand side element you see is the cooling plate. So you want to push in a slight forward motion towards the cooling plate. So you're rolling forwards and deploying the needles. What's important is to always have a quick look to assess that the cartridge is actually in contact with the skin and there's no gap on the actual north, south, east, or west parameters. You don't want to under or over rotate, and certainly over the bony areas of the actual face or of the shallower face, you want to ensure that you have pinched the skin to form a pillow, as you would buffer something up between the index finger and the thumb so that you do not actually hit any bony elements. Now, going to the actual tissue quality that you've got on the actual face, skin traction can be utilized by taking your index finger and your thumb and gently pulling the skin apart so that if you have any wrinkly bits or any deficits or defects within the skin, you can stretch the skin to ensure you're not over a bony area and you've got a flat, nice surface to deploy the needles through. You want to try and ensure that the tissue is stable, so no shaking from yourselves at all. And it's a very simple, non-scary treatment to do. You depress the actual trigger, the needles are deployed after the duration of either 3 or 4 seconds, depending on what you have set. The needles will retract and the machine will give you an indication to lift off. The ability of using the index finger and the thumb collectively just allows you to have less risk of skin movement as the needles deploy. Plus, it gives you a little bit of stability in holding and ensuring the patient doesn't move during the treatment. You must allow the tissue to relax back to its baseline before you actually sort of allow the radio frequency to pulsate. So hold the skin, either stretch or pillow, depending on the area of the face you're treating. Deploy the needles, allow the treatment duration to complete, lift off the actual probe, take your index finger and your thumb off, skin is relaxed, then move either 2, 3, or 4 millimeters north or south in your direction and repeat the process. Now, looking at the clinical endpoints when it comes to dermal treatment, again, concentrating on the actual face element here, the left-hand side picture, obviously, we can note the gender of the patient, we can note the actual skin type, the Fitzpatrick type, the skin quality. Although difficult to assess in a picture, it is still quite clear. This picture shows you clearly, after 67 degrees, single pass at 4 millimeter spacing, the area of erythema can be noted. Now, you will notice the white blanching element, and that is obviously the reaction secondary to the lidocaine and epinephrine. But you will notice pinpoint bleeding with scattered focal indurations along the route that you have treated. Noticeable blanching is also seen on the actual lower part of the face more than the upper part, because this is the primary part that was treated when the picture was taken. If I move to the actual right-hand side picture, again, we can note the gender, skin quality, Fitzpatrick type. This, again, is got 4 millimeter spacing with single pass. We can see more towards the mandibular area as opposed to the sort of maxillary area, the pinpoint ecchymosis resolving. What you will always see is, quite simply put, and when the patients look in the mirror, is these little sort of red dots that the patients will say, oh, I've got lots of little puncture marks. That's exactly what has occurred. Remember, your dermal cartridge has 5 pairs, so 10 32 gauge thermocoupled needles that will be going straight through the skin surface and causing this erythematous reaction. Again, we'll look at some progression photos. This is a patient that was treated. We can see the condition of the skin prior to treatment. Second picture shows the erythematous reaction immediately post. What's important is to guide your patients to say, this is something that may require them to have some form of downtime or away time from their day-to-day activities. We do find that an average of a week, sometimes up to 10 days, is or can be sort of suggested. As can be seen from this patient's picture, we can see primary, post, 2 days post the actual treatment. Obviously, the element of bruising noted here can be supported with the use of the actual laser V-beam device. And then you can see 1 week post the treatment, the erythematous reaction has primarily gone, with some areas remaining with a little bit of bruising. Obviously, the degree of skin quality can obviously cause an effect as to the duration of bruising that can be noted. But I do find all patients that have come through a week later have found that they are comfortable to return to their everyday either working or socializing elements. Again, if we look at the 2 specific areas, and we again spoke about this earlier when we looked at the actual submalar hollow, we can see the clearing up from the left-hand side picture to the right-hand side picture. We can clearly see the element of wrinkles has started to decrease and dampen down, therefore giving a slightly better, more youthful appearance to the patient. And that's a clear indication as to this was the right, correct device to use to achieve this. Now, although a busy slide, but important to recognize, we're going to go from the top left-hand side and follow it all the way to the right, and we will see how the patient's skin looked prior to treatment, straight after the treatment, moving to 24 hours later, moving to 48 hours later, now coming to the slide at the bottom left, looking at it 4 days later, a week later, and we can start to now see at that 1 week, whilst there still is a small element of erythema, we're starting to see a shape change in the actual angle area and the mandibular area of the face. Look at the difference 60 days later. The skin quality appears most certainly improved, as does the area treated. The appearance of the mandible and angle is far more prevalent than it was prior to the treatment. It's important to say to patients that often you won't see the maximum benefits of this treatment for at least 6 months, and even up to a year. The treatment will carry on showing you an improvement as more collagen, elastin, and hyaluronic acid is deposited and formed within the actual skin surface. This is a male patient, and again, we're looking at patients.
Dr.
Hello.
Schraag, we are almost at the end of the presentation.
Sure.
Yes.
Well,
please,
what I'll do, I'll take the questions if that's okay in a second. And obviously I will thank everybody for listening to the talk so far. Again, this was a patient which was a 6-month journey where we can see the difference in the actual chin and neck area to concentrate. But again, thank you all for listening so far. I will also just leave this on the screen for people to utilize, and I'll go to the questions. Now, one of the questions that has been asked here is, can we compare this product to, or can we compare the system to other systems? The systems that are listed, I won't go into, but what I will say is the Profound system is the only one that we have investigated extensively to find that you can adjust the time and you can adjust the temperature. And that is what makes the difference when you are trying to ensure that you get collagen, elastin, and hyaluronic acid deposition. So compared to the other systems that I've been asked to compare it to, I will mention the systems I've been asked to compare it to are the Infini, Vivasi, and Morpheus. I personally find that this is a far superior device, and we wouldn't go back and utilize the other systems listed more than the Profound. I've got a question here from a gentleman stating that, does the central needle deliver more energy or effect than the peripheral ones? And that is also, again, asked by someone else saying, when you are delivering the actual anesthetic solution, which is a tumescent solution, mix of, not the saline, but a mix of lidocaine, epinephrine, and sodium bicarbonate, that it appears the middle injection of the 3-injector plate will inject more anesthetic. No, that's not the case. When you actually deploy the plunger and inject local anesthetic, all 3 needles will achieve an equal effect and a flow of anesthetic to the skin. So the middle one will not get more, all 3 will get them equally. Subsequently, when you deploy the microneedles from the Profound device and stick into the dermal tip here, which has 5 pairs, you will have the same level of energy for the same duration at the same depth for all 5 pairs. A question has been asked, could you utilize this system and suggest it is more superior than high intensity focused ultrasound? Whilst I haven't done a direct comparison, this is a device that works beneath the actual surface of the skin, therefore delivering energy at the correct layer. I would say personally, yes, this is a superior device compared to HIFU because you are delivering the appropriate temperature for the appropriate duration at the right depth. So yes, I would say this is a superior device compared to HIFU. Do you still need external cooling or is it enough with the internal cooling? A great question. Most certainly, there will be erythematous reaction to the skin surface post the treatment. So yes, the application of carefully wrapped ice packs applied to the area treated will certainly benefit and help to recover from the redness that is experienced by the patient's skin. So yes, external cooling would be advantageous, and the patient can be advised to utilize cooling mechanisms safely, even at home, over the next 4 to 5 days. I've been asked here, do I always combine both tips? No, it depends on the results that you are looking to achieve. If you are looking to treat simple sagging, mild to moderate of the skin on the face, a dermal tip is more than enough. If you have mild to moderate sagging beneath the actual chin in the neck area, again, a dermal is enough. Should you have mild to moderate sagging on the face of the actual cheek, but a fatty chin, you may elect to utilize the SubQ on the chin and the actual dermal on the face. But again, it depends on what your baseline is starting off with. So no, you don't always combine the tips, but the combination of both when it comes to cellulite may be something slightly that is more advantageous. So you could use the SubQ on the cellulitic deposition, and if you have any loose skin above that, then the dermal tip applied above that will also help, because you will be targeting 6 millimeter depth and then targeting a 2 millimeter depth. So you've got an increased graded process of causing collagen, hyaline, and hyaluronic acid deposition in the entirety of the skin surface. I've been asked here, is this similar to PRP and microneedling? Well, the PRP element is obviously, and microneedling doesn't have the actual heat element, whereas the tip, the thermocouple, does allow the actual needle to have a heating element. So whilst the actual whole basis of penetrating the skin is similar in terms of putting a sharp device through the skin surface, it's not the same at all. Somebody, very kind, somebody said thank you very much. I've been asked it, will it give better results if you combine it with fractional treatment? In the clinic, we do utilize a pixel CO2 sometimes over the skin surface after treatment. Again, you must be somebody who knows and has experience to do this, because what we don't want to do is deliver so much heat and energy to the actual skin that we cause a burn. But if you are using a dermal tip and you find that there is still some superficial damage that you need to cause to help the skin remodel and heal, then yes, a pixel CO2 can be utilized over it, but safely, ensuring that you are confident in its use. In regards to what is the cost of the system, I will allow the Candela teams to answer that directly with yourselves. And your question is noted. I'm sure they'll get back in touch with you very, very shortly. One question I haven't been asked, there's another question, sorry. I've been asked, how long will the results last? What can you tell the patient? Do you need to repeat this treatment once every year? The results will last depending on the baseline severity of the condition. Whilst I often say to patients that you will see the maximal benefit somewhere between 6 months and 12 months after the treatment, you will see improvement prior, but your best results are seen between 6 and 12 months. I do find that some patients may benefit from a treatment every 12 to 24 months to ensure that they have further improvement in the actual collagen, hyaline, and elastin deposition. So yes, I say to them, these particular results will last a certain duration, and then with the natural effects of age coming into play again, you may need to repeat this treatment 1 to 2 years later. But don't forget, it's important, tell them, wait 6 months to 1 year to see the maximal benefits of the primary treatment. One of the questions often that I'm asked in clinic is, what areas have you found this has had the most benefit on? And whilst it certainly is greatly utilized on the face to help volumize the face, and obviously the aspects of the legs where cellulite may be utilized, we have found, and we have the luck of having a gynecologist in the clinic, that post-pregnancy, the laxity and wrinkling that can be seen around the umbilicus on the abdomen can be markedly helped with the use of the dermal tip being applied, just to dampen down the trauma from the birth that the patient has had to suffer and improve the appearance. I've been asked also, in between the profound treatment, should it be carried out on a yearly basis or a 24-month basis, could the patient do other treatments to maintain or improve skin quality? Yes, most certainly. We have many a patient who has had the profound treatment and subsequently has come back a few months later for various facials and or topical treatments to improve other parts of the actual skin and improve the general quality of the skin. So most certainly they can do other treatments. Please ensure that you maintain how much heat you are delivering to the skin. The last thing you want to ever do is cause any burns. But yes, they can do other treatments to the actual face itself. Same gentleman is asked, when would you start those treatments? I would wait at least 4 weeks post the treatment. The reason for that is people can still have some element of bruising 5, maybe 7 days later, and everybody has a different erythematous reaction time to recovery. So the reason I wait 4 weeks is I found that is the most adequate time for the complete duration of erythema, bruising, and to start to see some small elements of effect. I think going prior to the actual sort of 4 weeks would be too quick, but beyond 4 weeks, most certainly you've had enough time for the skin to start to recover, and you can look at other treatments as an adjunct to this. No, thank you. That's all right. Thank you. Happy to take any more questions in the interim. If not, I'm sure the Candela teams will be noting the questions that are coming through in regards to the costing and the financials of the actual system.
Thank you very much, Dr. Spra. This is the end of the webinar. Thank you all for attending.
Thank you. Take care.